My name is Jackie Powell, and I'm informing you on cerebral palsy. Cerebral palsy is a growing disease with prevalence increasing worldwide. There are new treatments being tested, as well as medications, regenerative techniques, physical and cognitive therapies, robotics, and functional neuromuscular simulations. Before we begin talking about what is to come in the future, let's start with a basic background. Cerebral palsy is any one of a number of neurological disorders that appear in infancy or early childhood and permanently affect body movement and muscle coordination. It appears before the age of 3 years old. There are 4 types: athetoid, which are involuntary movements, uncontrolled or unwanted, and that's in 10 to 20% of patients; spastic, which causes tightness in the muscles and difficulty controlling movements, and that's the most prevalent at 70 to 80% in diagnosing patients; atastic, which is jerky, uncoordinated movements caused by a disturbed sense of balance or depth perception, which is 5 to 10%; and mixed, which is a combination of any of the above types. The prevalence of cerebral palsy are that more than 500,000 Americans have been diagnosed. For every 100 girls, 135 boys are affected. 1 in 9 people with cerebral palsy have features of autism. 1 in 4 have epileptic seizures. 1 in 50 children with cerebral palsy are deaf. 1 in 20 have tremors and ataxia, and 1 in 3 children with cerebral palsy cannot walk. Characteristics of it are that there's a lack of muscle control and coordination, stiff or tight muscles, and a lack of ability to relax those muscles, exaggerated reflexes, tremors, spasms, and shaky movements, walking with one foot or leg dragging, stiff or loose muscle tone, stroke-like physical characteristics, which consist of a paralyzed side or paralyzed facial characteristics. In the early years, there's delayed development and early feeding difficulties. A number of other medical disorders that are associated with it include mental impairment, seizures or epilepsy, growth problems, impaired vision or hearing, and abnormal sensation or perceptions. The diagnosis of it consists of multiple tests. You could take an IQ to test the mental impairment, an EEG to trace activity in brain and reveal any suggestion of seizures, MRI to see internal structure of the brain, and an imaging test to look for tumors and structural abnormalities of the brain. Interdisciplinary teams of medical professionals gather to review child's strengths, weaknesses, previous tests and test results, risk factors, and the medical history of the family and the child. Cerebral palsy is an abnormality in parts of the brain that control muscle movement. It can be caused by any injury to the brain before, during, and after birth, such as seizure, stroke, lack of oxygen, long intensive labor, and medical emergencies during pregnancy. Cerebral palsy cannot be cured, but treatment improves a child's capabilities. Early intervention is key. Different treatments are physical, occupational, and speech therapy, prescription drugs for seizures to relax muscle spasms and alleviate pain, surgery to correct anatomical abnormalities or release tight muscles, braces or orthotic devices, and communication aids. The different implications that come along for parents are, most importantly, the cost of medical bills, therapy bills, and schooling, as well as receiving help to deal with the stress and emotions that come from the situation. Different resources for parents are the United Cerebral Palsy at www.ucp.org or www.ucpresearch.org, Pathway Awareness for Children with Movement Disabilities at www.pathwayawareness.org, Children's Neurobiological Solutions at www.cnsfoundation.org, local child care councils, and any assistive technology services can provide you with multiple information.